Seizure training for school personnel. Objectives: recognize common seizure types and their possible impact on students. Know appropriate first aid. Recognize when a seizure is a medical emergency. Provide social and academic support. What is a seizure? A brief excessive discharge of electrical activity in the brain that alters one or more of the following: movement, sensation, behavior, or awareness. What is epilepsy? Epilepsy is a chronic neurological disorder characterized by a tendency to have recurrent seizures. Epilepsy is also known as a seizure disorder. Epilepsy is more common than you think. Approximately 3 million Americans, 315,000 students in the United States, more than 45,000 new cases are diagnosed annually in children. 1 in 100 people will develop epilepsy. 1 in 10 people will have a seizure in their lifetime. Epilepsy is more common than cerebral palsy, Parkinson's disease, and multiple sclerosis combined. Did you know that most seizures are not medical emergencies? Students may not be aware they're having a seizure and may not remember what happened. Epilepsy is not contagious. Epilepsy is not a form of mental illness. Students almost never die or have brain damage during a seizure. A student cannot swallow his or her tongue during a seizure. Common causes of epilepsy. For 70% of people with epilepsy, the cause is unknown. For the remaining 30%, common identifiable causes include brain trauma, brain lesions like tumors, poisoning, lead, infections of the brain like meningitis, encephalitis, or measles, brain injury at birth, or abnormal brain development. Seizure types. Generalized seizures involve the whole brain. Common types include absence and tonic-clonic. Symptoms may include convulsions, staring, muscle spasms, and falls. Partial seizures involve only part of the brain. Common types include simple partial and complex partial. Symptoms relate to the part of the brain affected. Absence seizures. Pause in activity with blank stare. Brief lapse of awareness. Possible chewing or blinking motion. Usually lasts 1 to 10 seconds. May occur many times a day. May be confused with daydreaming, lack of attention, or ADD. Generalized tonic-clonic. A sudden hoarse cry. Loss of consciousness, a fall. Convulsion, stiffening of arms and legs followed by rhythmic jerking. Shallow breathing and drooling may occur. Possible loss of bowel or bladder control. Occasionally skin, nails, lips might turn blue. Generally lasts 1 to 3 minutes. Usually followed by confusion, headache, tiredness, soreness, and speech difficulty. First aid, generalized tonic-clonic seizure. Stay calm and track time. Check for epilepsy or seizure disorder ID, bracelet or necklace. Protect student from possible hazards like chairs, tables, or sharp objects. Turn student on his or her side. Cushion head. After the seizure, remain with the student until awareness of surroundings is fully regained. Provide emotional support. Document seizure activity. Dangerous first aid. Do not put anything in the student's mouth during a seizure. Do not hold down or restrain. Do not attempt to give oral medications, food, or drink during a seizure. When is a seizure an emergency? First-time seizures. No medical ID or no known history of seizures. Convulsive seizure lasting more than 5 minutes. Repeated seizures without regaining consciousness. More seizures than usual or change in type. Student is injured, has diabetes, or is pregnant. Seizure occurs in water. Normal breathing does not resume, or parents request emergency evaluation. Follow seizure emergency definition and protocol as defined by the healthcare provider in the seizure action plan. Simple partial seizures. Full awareness maintained. Rhythmic movements, isolated twitching of arms, face, and legs. Sensory symptoms, tingling, weakness, sounds, smells, tastes, feeling of upset stomach, or visual distortions. Psychic symptoms like deja vu, hallucinations, feeling of fear or anxiety, or a feeling they can't explain. Usually lasts less than 1 minute. May be confused with acting out, mystical experience, or psychosomatic illness. Complex partial seizures. Awareness impaired or an inability to respond. Often begins with blanked dazed stare. Automatisms, repetitive purposeless movements. Clumsy or disoriented movements, aimless walking, picking things up, nonsensical speech, or lip smacking. Often lasts 1 to 3 minutes. Often followed by tiredness, headache, or nausea. May become combative if restrained. May be confused with drunkenness or drug abuse or aggressive behavior. First aid for a complex partial seizure. Stay calm, reassure others, track time, check for medical ID, do not restrain. Gently direct away from hazards. Don't expect student to obey verbal instructions. Stay with student until fully alert and aware. If seizure lasts 5 minutes beyond what is routine for that student, or another seizure begins before full consciousness is achieved, follow emergency protocol. Seizure triggers or precipitants. Flashing lights and hyperventilation can trigger seizures in some students with epilepsy. Factors that might increase the likelihood of a seizure in students with epilepsy include missed or late medication, number one reason, stress, anxiety, lack of sleep or fatigue, hormonal changes, illness, alcohol or drug use, drug interactions from prescribed or over-the-counter medicines, overheating or overexertion, poor diet or missed meals. The impact on learning and behavior. Seizures may cause short-term memory problems. After a seizure, coursework may have to be retaught. Seizure activity without obvious physical symptoms can still affect learning. Medications may cause drowsiness, inattention, concentration difficulties, and behavior changes. Students with epilepsy are more likely to suffer from low self-esteem. School difficulties are not always epilepsy-related. Tips for supporting students with epilepsy. Stay calm during seizure episodes. Be supportive. Have a copy of the child's seizure action plan. Discuss the seizure action plan in the student's IEP. Know child's medications and their possible side effects. Encourage positive peer interaction. Avoid overprotection and encourage independence. Include the student in as many activities as possible. Communicate with parents about the child's seizure activity, behavior, and learning problems. Contact information. The Epilepsy Foundation Information Referral Line is 800-332-1000. Or you can reach them at www.epilepsyfoundation.org. Optional topics: convulsive seizure in a wheelchair, convulsive seizure in a school bus, convulsive seizure in the water, ketogenic diet, diazepam rectal gel, or vagus nerve stimulator. Convulsive seizure in a wheelchair. Do not remove from wheelchair unless absolutely necessary. Secure wheelchair to prevent movement. Fasten seatbelt loosely to prevent student from falling from the wheelchair. Protect and support head. Ensure breathing is unobstructed and allow secretions to flow from mouth. Pad wheelchair to prevent injuries to limbs. Follow relevant seizure first aid protocol. Convulsive seizure on a school bus. Safely pull over and stop the bus. Place student on his or her side, across the seat facing away from the seat back, or in an aisle if necessary. Follow standard seizure first aid protocol unless seizure abates and the child regains consciousness. Continue to destination or follow school policy. Convulsive seizure in the water. Support head so that both the mouth and nose are always above the water. Remove the student from the water as soon as it can be done safely. If the student is not breathing, begin rescue breathing. Always transport the student to the emergency room even if he or she appears fully recovered. Ketogenic diet. Based on a finding that burning fat for energy has an anti-seizure effect. Used primarily to treat severe childhood epilepsy that has not responded to standard anti-seizure drugs. Diet includes high fat content, no sugar, and low carbohydrate and protein intake. Requires strong family, school, and caregiver commitment, no cheating allowed. It is a medical treatment, not a fad diet. Vagus nerve stimulator. Device implanted just under the skin in the chest with wires that attach to the vagus nerve in the neck. Delivers intermittent electrical stimulation to the vagus nerve in the neck that relays impulses to widespread areas of the brain. Used primarily to treat partial seizures when medication is not effective. Use of a special magnet to activate the device may help students prevent or reduce the severity of an oncoming seizure. Student may still require anti-seizure medication. Diazepam rectal gel. Used in acute or emergency situations to stop a seizure that will not stop on its own. Approved by the FDA for use by parents and non-medical caregivers. State school district regulations often govern use in schools. Thank you for watching this PowerPoint. If you have further questions, please feel free to contact the school nurse about a student. Also, this PowerPoint will be available on the school website for further review. Thank you.